Welcome back. The American Cancer Society predicts 1 out of every 2 men and 1 out of 3 women are likely to have cancer someday. Joining us this morning from Gundersen Health System to discuss cancer screenings, Dr. Roger Kwong. Dr. Kwong, thanks for being here this morning.
Are you hearing us okay, Dr. Kwong?
Yes. Good morning.
So cancer screenings, what's the timeline? When should people start thinking about getting screened? I mean, cancer is such an all-encompassing disease. What do you look for in a patient to get screened?
Well, the screening criteria, of course, have changed over the years. The awareness of the possibility of cancer is primary, and what we would recommend is that you discuss it with your doctor for your specific circumstances when screening should be started. It depends a little bit on your personal and family history.
Sure. For women specifically, what types of cancers are most prevalent that we should be thinking about?
Cervical cancer of the uterus is the most common and probably the earliest screening that should occur. Breast cancer is next, whether that's at 40 or 50, again, may be something that you should discuss with your primary physician. Colon cancer screening for average risk individuals starts at 50. At the time of menopause afterwards, endometrial cancer might be recommended. Prostate cancer screening depends a little bit upon, again, the conversation you have with your physician.
Yeah, and prostate cancer being the #1 cancer among men, what do you know what the timeline is about when men should start looking at that?
Again, African American men, it will be an earlier age than for Caucasian men. Family history makes it a difference there. The recent changes in screening recommendations have changed a bit. Rather than starting at 50 as it used to on average. Again, prostate cancer screening, much like lung cancer screening or breast cancer screening, is for early detection, whereas uterine cancer screening with a pap smear or perhaps colonoscopy is preventative. There are some other colon cancer screenings, such as looking for fecal blood, that may be early detection rather than prevention.
Right, and some other preventative efforts, besides getting those screenings, your lifestyle also affects, obviously, your chances at getting cancer.
Right, and the earliest one there probably is for melanoma from sun exposure, particularly serious sunburns in pre-pubertal children is a problem. It's the reason why tanning salons have been restricted for those under age 18.
Yeah, so
because of increased melanoma.
Right, yeah, use a lot of sunscreen and just as we always say, eat healthy, get moving, and try to reduce your cancer risk in those ways as well. And Dr. Kwong, thank you so much for joining us this morning and sharing some of these signs of screening.
You're welcome.